Hi, good morning, Calvin. My name is Mahira. I'm your invigilator for the OIT speaking session on the 9th of December 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Calvin Lawrence.
All right, Calvin, could you please confirm your candidate number?
Yes. My candidate number is 435336237.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mahira.
How do you think the role of nurses will evolve in the future?
With advancements in technology and medical science, I believe nurses will play an increasingly vital role in healthcare. We will likely see increased involvement in telehealth, preventative care, and community health initiatives. Nurses will also need to adapt to changing healthcare demands, develop new skills, and embrace technological advancements to continue providing optimal patient care.
What are some of the biggest challenges you face as a nurse?
One of the biggest challenges is dealing with stressful situations and difficult decisions. Prioritizing tasks and managing time efficiently are also crucial in this fast-paced environment. Additionally, witnessing a patient's suffering can be emotionally draining, and it's important to practice self-care to maintain resilience.
How do you stay motivated and positive in your job?
I stay motivated by focusing on the positive impact I have on patients' lives. Remembering the smiles and gratitude I receive fuels my passion for nursing. I also find inspiration in my colleagues and their dedication to providing quality care. Additionally, maintaining a healthy work-life balance and engaging in activities I enjoy helps me stay positive and energized.
Describe a time when you went above and beyond for a patient.
I once cared for a patient who was incredibly anxious about an upcoming surgery. I spent extra time providing them with information and emotional support, answering their questions patiently, and reassuring them throughout the process. Their fear gradually subsided, and they expressed sincere gratitude for my compassion and care. This experience reminded me of the profound impact nurses can have on patients' lives beyond their medical needs.
What are your career goals as a nurse?
I'm passionate about continuous learning and professional development. I aspire to specialize in a specific area of nursing, such as pediatrics or critical care. Additionally, I'm interested in pursuing leadership roles and contributing to improving healthcare policy and patient advocacy. Ultimately, my goal is to make a significant difference in the lives of patients and the nursing profession as a whole.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mahira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mahira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi Mihira, I'm Nurse Calvin. I'm here to talk to you about your son's condition. I just finished taking his clinical observations, and everything seems to be stable. Don't panic. How are you feeling?
To be honest, I'm quite upset. It's all been very overwhelming. I'm just so worried about my little boy. He's so young, and everything has happened so quickly.
It's understandable that you're feeling this way. Seeing your child in hospital, especially with tubes and machines, can be very scary for any parent. Mihira, do you have any specific concerns to be addressed?
You're right, it is. I find it hard to see him hooked up to everything. It's just so unnatural. I keep thinking back to when he was born and how healthy he was.
I can imagine how difficult this must be for you. Mihira, I want to assure you that your son is in good hands. We have a team of experienced doctors and nurses who are dedicated to providing him with the best possible care.
I know, and I appreciate that.
I understand you're worried about your son. I want to assure you that he's comfortable and not in pain. Now, I would like to take this opportunity to explain about the tubes fitted to your baby.
You may please, I am worried about seeing it.
Yes, Mihira. The IV line helps prevent dehydration by giving him fluids directly into his bloodstream, and it also allows us to administer any necessary medications, like antibiotics. Next is the nasogastric tube, which helps relieve pressure on his stomach, and allows us to remove any stomach contents that could be causing discomfort. Mihira, these are important steps in helping him recover. Be comfortable, we'll be monitoring him closely, and keeping you updated every step of the way. Is there anything else you'd like to ask or clarify?
Thank you for the explanation, nurse. This makes me feel a bit better. But I just want to make sure the nurses will be checking on him regularly to make sure everything is all right.
Absolutely. Don't worry, Mihira, we'll be checking on your little one regularly, taking his temperature and blood pressure, and monitoring for any signs of pain or discomfort. We'll update you on any changes we observe. Additionally, let me tell you the next steps in his treatment procedure. Soon, he'll be transferred to the X-ray department, where our medical team will perform a short procedure to get a clearer picture of his condition. After that, he'll be brought back to this ward for further monitoring and rest. We'll be here with him every step of the way, and we'll keep you informed throughout the process. In the meantime, if you have any questions or concerns, please don't hesitate to ask. We understand this is a difficult time for you, and we want to support you in any way we can.
Thank you, Nurse Calvin. I do feel a bit better knowing that you're here and that his condition is stable. Nurse, can I be with him during the procedure? Because I feel like I should be there for him, especially since he's so young.
I can understand your concern, Mihira. However, the procedure involves being in a specific environment, like an X-ray room, where only medical personnel are allowed. Additionally, your son will be sedated for his comfort and safety. No need to be concerned, Mihira. It's a relatively short procedure, and we will keep you updated throughout the process. We understand that this is difficult for you, but we need to ensure that the procedure runs smoothly, and that your son receives the best possible care.
All right, I understand. I'll try to stay strong. Can I at least be with him until they take him for the procedure?
Of course, you can. We believe it's important for parents to be present for their children whenever possible.
Thank you so much, Nurse Calvin.
You're welcome, Mihira. We're all here to support you and your son during this time. Please don't hesitate to ask us if you have any questions or concerns.
Thank you. I will. That is the end of your OIT speaking role play. All the best.
Thank you, Mihira.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.